Tēnā koutou katoa, talofa lava, maloa lele, bulavanaka, and kamusta. A warm welcome to everybody on behalf of CHASNZ. My name's Chris Falachuk, and today we're hosting an important discussion on the COVID vaccine for construction workers. At CHASNZ, we believe it's healthy to be talking about this, and we encourage all construction workplaces to be open and supportive of each other, regardless of what your personal views are on vaccination. Today, we've got a top crew, and we've asked Richie Heppy from Mates in Construction. We've got Dr. Tom Mulholland, aka the Doctor on a Mission, and E. Haka Ronganui from Turbo Staff here today hosting them at CHASNZ to answer some of these questions.
And thank you to the panel, and thank you for the opportunity to be involved and share some of my knowledge and my experience of 32 years of being a doctor. My mahi is I believe people can take control of their own emotions and well-being to lead longer, happier and healthier lives. And we need tools to do that, and vaccination is one massive tool. And my health views, well, why are we doing this? You know, our hospital system just can't cope with widespread COVID. It barely does now. I was in Te Anau working in the rescue chopper a few months ago, and, you know, Southland Hospital closed the wards because of this RSV virus. There's other deaths from waiting room. You know, people just can't get their operations. As I say, I talked to my mates in Glasgow. I talked to my mates in Sweden, ED doctors, and they were just swamped with COVID. Now that a lot of people have been vaccinated, that overseas, that it's gone down to a trickle, the amount of people that are being admitted to intensive care. Now, I haven't got this information on Facebook. I haven't got it off any other social media. This is talking to my friends and my colleagues that do the mahi every day. You know, we like the builders, we're the tradies at the hospitals, right? And our overseas experience is if you're vaccinated, you're far less likely to die of it or go to hospital. So it's a really important tool we have to fight this thing. In 32 years in the front line, I see what happens to the unvaccinated every day. It'd be like, you know, you're going to work and whatever you're constructing and you don't have any safety gear, and I go along and just do it without safety gear, and you go, bro, sooner or later you're going to have an accident, right? I understand how it works and antibodies are like bullets, and I want to spend maybe 5 minutes just explaining how vaccination works. And I've had a lot of vaccine hesitant people in my clinic in the last few days, elderly people were not getting vaccinated. Why? We think it's DNA. And when I actually explain to them what it is, at the end they go, wow, that's so cool. I didn't know that. Because you don't know what you don't know, right? If you put me on a construction site and said, Tom, go and do this, use this tensile steel, I'm like, what? I wouldn't know what to do. We need to wage war on this COVID virus, you know, but me going to work without antibodies is like going to a war with a gun and no bullets. So my immune system is the gun, but without antibodies, I've got no bullets, right? Or no nails. This is what a virus looks like, and it might look pretty, but it ain't. That's the measles virus, right? Now, most of us have been exposed or vaccinated to this measles virus. This is the COVID virus, and it's called a novel coronavirus because we've never seen it before. It's come from bats. We've got no antibodies. We've got no nails. We've got no immunity, right? Right? This is what coronavirus looks like in your lungs, right? So you get pneumonia, and this is what unvaccinated coronavirus, this is why you end up in intensive care, because you can't breathe, your lungs are wet. It's pretty hard to get a feet of powers when your lungs look like that, let alone breathe. How the virus works, what it does is it injects its DNA and RNA into our cells, and then it makes more and more viral particles. Your cells then bust open, and then it sends all these other viruses out, all its babies, and infects your friends and whānau, right? And that we've got to stop it getting into our cells. So how do we do that? We produce antibodies. So if you look at measles, that's what the virus looks like. We've got these, if you're constructing something, you know, you put a screw in or you put a bracket in or a clip, it needs to fit, right? So we have antibodies that fit and take out the measles virus. Same with the flu, it changes every year. That's why we get new flu viruses every year, because it mutates a little bit. The chickenpox one, we have, you know, if you once you have chickenpox, you don't get it again, right? Because you've got all these antibodies that protect you. We haven't seen the coronavirus before. That's why we need to protect ourselves by giving a vaccine. So what's in the vaccine? It's basically 4 things. Sugar. We coat it with sugar so our body doesn't attack it. A bit of salt. It has a bit of fat in it, but it has this thing called mRNA. Now that's messenger RNA. So when we need to copy, you need to send plans. Think of this as a factory that's making gibboard, right? So what you need to do is you need to send the plans to the factory, which are these ribosomes, which are in the cell, and they make all the spike protein, right? Which is on the virus. They're not making the virus, they're making this protein. Then what happens is protein goes into our blood cells, and our B cells go, we need to make antibodies or nails against this. So we're being very, very clever, and we're sending just the plans only to the ribosomes. It doesn't go into the nucleus, all that stuff. It just goes to the factory, and we start making protein, we start making antibody, and we're getting ready to fight the virus when it comes. How it works. So the mRNA sends the plan to the factory, the ribosomes. It makes the spike protein, not the virus. The B cells then make the nails, the antibodies, then nail the virus spike protein. If you aren't vaccinated, you have no nails. And the only way to make the nails is to catch the virus. You can get really sick or even die of it. It takes 2 weeks for the factory to make the spike protein, then the B cells to make enough to protect you. So imagine you want a whole lot of jib or whatever you need for your construction. You know how long it takes to get this stuff. You want your system ready to go. The nails or the antibodies may last about 8 months, but the factory still has the plan. So if you do get the virus and your antibodies have dropped a little bit, the factories can start making them real quick to protect you, to neutralize that virus. So your body's constructing to make these nails or these little antibodies look like Ys, and the more you have, the more virus you can fight. But that's why it doesn't cure it, because a few viruses will get through, but they'll only whack a few cells out. It's like Star Wars or something. You know, you've got all these, you're firing all these things out, and you'll get most of them. If you don't have, if you're not vaccinated and you don't have protein, then they're just going to smash your cells, right? That's why we still get it a little bit if we're not vaccinated, some of us, but at least we've got an army that'll fight it. So you've got to think as antibodies like nail guns, and you want a nail gun and you want to nail this thing. And the beauty of getting the vaccine is you're allowing your own body, which is a construction organization, is to construct antibodies to fight this disease. That's what we've got to nail, and that's why you need nails, and that's why you need vaccination, and that's why you need antibodies. So one of the questions I get asked is, but isn't the vaccine more deadly than the virus? No way. If you look at, there's 5 million doses been given, and if only one person had died, for the vaccine to be more dangerous than the virus, you'd need 30,000 people to die. So the vaccine is safe, it's well researched. There's never been anything more. There's been billions and billions of doses of this given worldwide. This is the most studied thing we've ever studied, right? We don't study paracetamol as much as we study this. We don't study antibiotics as much as we study this. All right. Happy to take questions or concerns from the panel. And, you know, there's a really good website there that's got so many questions straight away. Like, let's kick off. Don't want to steal your thunder, but does COVID cause infertility? No, there's no way that it can. It's like saying, well, I nailed up some 4x2, and then, you know, 6 months later, my hot water doesn't work, right? There's no relation. There's no mechanical way that mRNA can attack your sperm or attach your ovaries, right? It just can't happen, right? So, and it's the same as other vaccinations, and there's no data to prove that. So that's just a myth that people are spreading, right?
Oh, killer, bro. Killer, Dr. Tom. So, you know, here's a question. So the speed in which the vaccine was rolled out, okay, and approved and all that sort of stuff. So this is making people feel a bit uneasy. Should that be? Should we be feeling uneasy, cuz?
No way, because it's like it had to go through clinical trials, phase 1 trials, phase 2 trials. So it was trialed on people, and then they measure the antibody, and they got to say this works. I mean, imagine if they had just rolled it out and go, well, let's give everyone a shot of gibboard or something, you know, and then it doesn't work. Then, you know, we have to prove that it works, and the science is showing that it's working, because, you know, you're so far less, you know, likely to get infected. So it was well researched. This technology's been around for a long time. We've just got clever at it. And vaccination's been around, you know, since before and polio when I was born. So the process is the same. We've just got smarter with the technology. So it's 50 years worth of science with just some new little smarts by using, you know, the mRNA. So it's not rushed. It's not, you know, it's been gone through trials and rigorously tested. And now we've had the biggest test of all. You know, billions of people have had it. 5 million in New Zealand. Like, that's not rushed, you know. And all you presumably have it. We're all fine. You're not attracting magnets. Don't want to steal your thunder.
and that is a thing. And it is a thing, so no, bro, because I saw on Facebook, which is quite funny, is they're saying, hey, look, you take the vaccination, you're going to turn into a magnet. Well, I've had 2 vaccinations, so which means I've got double, the capacity to be magnified. So I'm looking at taking a trip to the North Pole. I mightn't be able to get there because I'm magnetized. But anyway, is there any truth to that, brother?
No, zero. And it's just, how can you be magnetized? It just doesn't make sense. And people that are vaccine hesitant, right, which is cool, it's fine. I'd be scared too if I hadn't had all this knowledge and training, and I don't see many sick people, then I'd be vaccine hesitant as well. And as I said, this week I've had like elderly couples come in, and they're asking for notes so their whānau could come and visit them, and I'm going, but you don't want to bring them here because are you vaccinated? No, we're scared, right? If you are worried and vaccine hesitant, go and talk to your doctor, right? And talk to them and have that open discussion, right? We study this, right?
Hey, kia ora koutou. So my name's Ihake, as I mentioned before. I'm Managing Director of a recruitment agency here in New Zealand called Turbo Staff. I also represent a not-for-profit collective group called OneScope, which is effectively a group of forward-thinking labour hire agencies that employ up to anywhere around 5,000 to 6,000 workers across New Zealand. So I just want to touch on the hesitancy due to pre-existing conditions. So I guess constant queries that I was getting across all the agencies in and around the fact that we employ quite a lot of Filipino and migrant staff, a lot of which have worked in the Middle East, mainly Saudi Arabia and Dubai. A lot of them come over with pre-existing tuberculosis past experiences. Obviously, in those situations with anything respiratory, they're a bit hesitant around that. Is there any place or way that they can go get some more of education, or whether they can find out if one vaccine is more appropriate for them than another one when it gets to this, when it gets to choosing a vaccine?
Oh, look, that site that I just had up there before, go to immune.org.nz, that'll give you that information. But look, if you've got pre-existing conditions like type 2 diabetes, or you've had TB or respiratory problems, or you smoke, right, you want to be grabbing the vaccine as quick as you can, because you are the most at risk of dying of this thing or getting really sick, right? So you don't have a choice currently. The only vaccine around is the Pfizer vaccine, which has been really, really well tested. We're up front about, I posted on Facebook after my second dose, I got the chills, I got the sweats, and I was stoked about that, because that shows that my immune, my factory, like I'm constructing antibodies, right? Because when you feel sick with the flu, it means that you go, oh, you got those chills, that's all your T cells and B cells going to work. So I felt confident. I took a Nurofen or 2 Nurofen and 2 paracetamol. Next day I'm right as rain. So the only contraindication for not getting the vaccine is if you've had a serious allergic reaction to any other kind of vaccine like this before. Here's a tip, right? Is the vaccines that we see the most side effects is often young males, which is your and young females, but males more with maybe this heart thing, and it's because they're getting the vaccine, they've got such a strong immune system that and then they're going out and they're producing so many nails that they've got all these nails. And then they go and exercise on top, like go and run or go to the gym. Like once you're vaccinated, you want to rest for 48 hours and give your system time to settle down, right? And I see myocarditis and heart stuff is in the emergency department, and people get the flu and they got a sick and they think, I'm going to run through that, I'm going to smash through that. All you're doing is driving viral particles into your heart. And the point is that I'd say, don't exercise if you're sick. You want to rest, and after you've been vaccinated, young male, I really advise that you rest for 48 hours, drink plenty of fluids, take the paracetamol, and a lot of people will get sick or feel sick on that second dose, but you're supposed to. That's the whole point, because your immune system's kicking in. So hopefully that answers your question, Yeah, no contraindications, but talk to your doctor if you're worried, or your vaccination, the vaccinators are all trained in this. They'll answer your questions.
Sorry, bro. What about asthma? Asthma, because when high levels of Māori have asthma. I have asthma. No, I have bad asthma actually, and I still wouldn't got the vaccine though. But is there any effect on asthmatics?
No, not at all. And the thing is that, you know, if you're an asthmatic, it makes you more susceptible when the virus comes in and gets into your cells. I mean, you're going to wheeze like mad. And with asthma, what it is your pipes squeeze down because they don't want to get, and that's why you whistle and wheeze. If you load COVID onto that, plus that RSV, you don't want that.
Hey, just one. So I'll give you an example of if we talk about things going viral on social media. One thing in my experience, and it's only when I say viral, it was a rumor that went amongst, I guess, probably about 20 guys of ours on one construction site in particular. It traditionally took 8 years for them to perfect it before they'd actually give it to human beings. Yet we get this one out the door within 1 year. My response is, and I'm not a professional, but I try to say to them, well, you can only imagine that there's 10 times more amount of focus on getting this one perfect in a small amount of time, but at the same time too, I know I really don't know what I'm saying. Can you outline around the difference between why this vaccine is safe after a small amount of time versus some of the ones in the past?
The answer is because the technology is just so much better, right? Like, how long did it take to build a house 100 years ago, and how long does it take now? Well, it depends on how much labour shortage you got, right? Because that's the rate limiting step, is trying to get workers. But just the technology now is so much cleverer and smarter. We can smash the stuff out. Plus, the whole world was working on it, right? You had everyone working on it because it's the biggest threat to us currently. So you got a lot more resource. It's like saying, you know, it just depends on how many workers you got on there, right? And the more tools you have and the more people and the better the technology, the faster you can build it. So we've just got fast technology now. And as I say, you can't get a better test now. And it's real simple. What we're making is protein, so it can't get you down the track. It's not like there's something in there like a chemical like thalidomide or some whatever's in gibboard that we're putting into you. We're just putting in a bit of sugar, salt, fat, and a message to make this protein, which we make antibodies to. It's really specific, you know. That's the cool thing about it. It's not a whole lot of mashed up virus injected into you and go for it, your body. It's just one little thing, one little nail.
Awesome. Hey, so Dr. Tom, are there any long-term effects or even short-term reactions? I know you talked about your reaction after your second shot. I reacted to my second shot too. It was like having a flu, but it only lasted about 12 hours for me. But you know, in the long term, you know, is there any effects that we need to be worried about?
Oh, well, look, the answer to that, it hasn't been around, you know, long term, but the long term effects of COVID, it's like are massive, you know, and I've seen patients that have lost half their lung volume, you know, that have been infected by COVID, and there's a thing called long COVID you might hear about, but we're seeing lots of people coming in with clots from having COVID, not from the vaccine, but from overseas, people coming back. Miscarriages, pregnancy, you know, is a massive risk in pregnancy with having COVID now, and kids getting it, kids getting hospitalised, and you know, when that first came out and people says, oh, kids can't get it, I said, that doesn't make sense because kids have an immune system, you know, and kids transmit it, you know, and that's another important point, that you want to get vaccinated so you really reduce the chance of you giving it to someone else. But I'm not worried at all about the long-term effects, because I can't see how there would be, because we're just making this very specific protein and we've got our own antibodies, and it's my factory that I've enabled. It's not like I've stuck another factory in. It's my ribosomes making my proteins, and it's my immune system that's been strengthened. So, you know, we're not fighting any other wars.
Excellent, kōrero, guys. Really much enjoyed that. We better sign off soon. Have we got any last comments from you, Tom?
You know, talk to people that have been vaccinated, you know, if you're worried and hesitant, and see how they've got on, you know. And I can't, like the kōrero now that we have from I'm getting, you know, is how we're going to deal with this in the community as GPs, and we're ramping up, you know, for how we're going to treat it. And you know, we can't hide forever, and in the messages, like it, you know, it's already like people going, well, we've locked down. You just can't keep doing that. Talk more, ask more questions. You're entitled to ask questions, and you know, get the right answers, but get it from experts. You know, it's like I wouldn't go to Facebook and ask how to put up a truss or a retaining beam, or that. You know, I wouldn't put that. I wouldn't go there. I'd go to a master builder, or I'd go to someone or an architect to build the plan. And so, you know, get your advice from the experts that deal with this every day. Just don't go and DIY.
So before you go, bro, can I just ask this question? Because I work on multiple sites, and I've just been out this week on some sites, promoting vaccinations. And one of the questions is this. So if everybody else is getting vaccinated, right? Then I don't need to get vaccinated, or at least it's my choice to get vaccinated. Yeah. Then if the person that I'm working alongside is vaccinated, should me not getting vaccinated bother them?
Definitely, because you'll still give it to them, right? And you'll still give it to them because you're catching you've got this big viral load, right? And it's like saying, let's say there's a tenny on a harness or whatever using safety gear, right? And one of you is not wearing, protective gear, then you're gonna infect them, right? You're gonna damage them, and it's like infect other people, right? And vaccination is not 100% guarantee. As I say, you've got lots of nails, but if you turn up with, a whole lot of holes, right, and everyone's going to try to hit them with their nails, you're going to run out of nails. You're bringing a hazard to work, right? It's like bringing crack to work.
So it's part of your PPE, basically, what you're saying.
Exactly. Yeah.
Ihaka, any words from you to finish off?
No, I just want to say, pass my appreciations over to Tom, Richard, Rachel, and yourself, Chris. As an employer for the staff in construction, I guess we're just trying to navigate our way through the next few months. We can be communicating the right solid information down the line so that our men and women on the ground know what's happening. Okay,
boys, thank you for your time today. I hope everybody enjoyed hearing from you. I certainly did. Thank you, Dr. Tom. Ka pai. Thank you, Richard. Thank you, Ihaka. We'll see you again soon, eh?
Yeah, Mihi, thank you very much. Stay safe.
Cheers, boys.
Dr. Tom. Ka kite, bro.
Ka kite.
Ka kite. Bye-bye.